Hi there, it's Dr. Hart again, and these are some practice questions on the topic of nutrition. This is an important topic. Nutrition falls under the category or subcategory of basic care and comfort. This is the breakdown that I've been showing on my videos. It gives you a breakdown of each of the main categories of the NCLEX test plan. This is directly from the Board of Nursing website. You can look this up for whatever state you're in, and this will give you a breakdown of each category and subcategory for the NCLEX test plan and the percentages for each category and subcategory. So for the subcategory of basic care and comfort, nutrition is one of the subjects that's under that subcategory. Okay, so some of the things that are important in nutrition are knowing vitamins. You have to know your vitamins, carbohydrates, what happens with a certain lack of certain vitamins, what can happen with deficiencies, what can happen if what vitamins can interact with medications. And you should know the signs and symptoms of deficiencies in children especially. You should know those for your pediatrics section of your nursing school. And so let's do some practice questions on nutrition. I tried to pick the ones that I think that I've seen before and I've used before in the past and that I think are important. Okay, so here's the first one. A woman consumes pasta, grains, and other carbohydrates for which purpose? Okay, so here you have to know the main function of carbohydrates. Is it A, weight gain, B, energy, C, weight loss, or D, source of fiber? Okay, so when you're looking at these answer choices, okay, you may see, especially if it's a select all that apply, which this is not, but if in a select all that apply especially, you may see answer choices that are opposites. So here we have weight gain and weight loss. Okay, so I'm not going to say all the time, but most of the time I would throw those out or disregard those as an answer choice, those opposites. Okay, not all the time, but I would take another close look at those answer choices that are opposites. Okay, so we'll give you a minute to think about this one and then we'll come back. In the meantime, I'd like to encourage you, if you are benefiting from this content, if you would like to like, share, and subscribe to my YouTube channel, which is Nursing with Hart, PhD. I'm also on TikTok, Susan Hart 63, and I am going to begin posting on Instagram as well. Okay, so let's come back to this test question. So a woman is consuming pasta, grains, and other carbs for what purpose? What is the purpose or main function of pasta, grains, and other carbohydrates? Okay, and the correct answer is letter B, energy. Letter B as in boy, energy. So the main function of carbohydrates is to provide energy. Okay, so in this case, the weight gain, weight loss, if you took them out, that was a good elimination. Okay, I'm not going to say always, but if you get two answer choices on your question that are opposites, like weight gain, weight loss, take another look at those. Okay. All right, next one. An athlete wants to increase his or her intake of complex carbohydrates and asks the nurse about potential sources. Which food is considered a complex carbohydrate? Okay, and this is a typical nutrition question that I've seen on ATI and standardized testing platforms. Okay, which food is considered a complex carbohydrate? Your choices are A, molasses, B, syrup, C, brown sugar, and D, bread. All right, we'll give you a minute for this one, and then we'll come back. Okay, we're back. So which one is considered a complex carbohydrate? Okay, and the correct answer is letter D, bread. So bread, cereal, potatoes, rice, pasta, crackers, flour products, and legumes contain complex carbohydrates. All right, next question. A client has just had abdominal surgery and the nurse is consulting with the client about the diet now that the client is allowed to eat. Which nutrient is most important for wound healing? Okay, which nutrient is most important for wound healing? Okay, so your choices are A, carbohydrates, B, protein, C, fats, or D, vitamins. We'll give you a minute and we'll come back. Okay, we're back, and this one is asking you which nutrient is most important for wound healing, and the correct answer is letter B, protein. Okay, this is a pretty straightforward question, but I've seen this quite often, and I've used this type of question often as well. Okay, so complete proteins contain sufficient amounts of the essential amino acids to maintain body tissues and to promote growth. Okay, so what foods are excellent sources for protein? What foods have protein? Okay, think poultry, which is chicken, fish, eggs, dairy and plant-based options like legumes, nuts, and seeds. Okay, have protein. And if you look at the test question, the client has just had abdominal surgery. So what are they going to have? They're going to have an incision, which is a wound that is going to heal or is trying to heal. And you want to educate your patient on how to promote the most wound healing. Okay, and that's to encourage the ingestion of protein-containing foods. Okay, next question. To promote health of the fetus, the nurse should instruct the woman in the first trimester of pregnancy to A, eliminate high fiber foods, B, eat foods high in folic acid, C, consume saturated fats, or D, consume milk products in the last trimester. All right, we'll give you a minute for this one. Okay, we're back. And the correct answer, this is another question I've used quite often and I've seen quite often in standardized testing and unit exams. The correct answer, okay, and this one is letter B, eat foods high in folic acid. Okay, folic acid deficiency in pregnant women can lead to neural tube defects in the fetus. Women during pregnancy may experience constipation. Increased fiber intake is recommended. Saturated fats are to be eaten only in moderation, and milk products are important during the entire pregnancy. Okay, so that last answer choice, milk products in the last trimester, you might pick that because you're thinking, yes, milk products are important. Yes, they are, but they are important during the entire pregnancy. So that wasn't the best answer. Okay, best answer is foods high in folic acid to prevent neural tube defects in the fetus. All right, next question. The nurse is providing education to a client concerning calcium intake. During the discussion, the nurse addresses a potential health concern related to inadequate calcium intake. Which condition is most impacted by inadequate calcium intake? Letter A, dental caries, B, anemia, C, osteoporosis, or D, dry eyes. All right, we'll give you a minute to think about this one. Okay, and on this one, the correct answer is letter C, osteoporosis, okay, with an inadequate calcium intake. Osteoporosis is a condition where there's a reduction in bone density, okay, mostly in older women. Factors contributing to the development of osteoporosis are chronically insufficient calcium intake, decreased estrogen, heredity factors, smoking, race, and decreased physical activity. Okay, so with a decrease in estrogen, that's going to be women who have gone through menopause. Okay, letter A, if you're not sure what dental caries is, those are cavities. Dental caries are cavities. Okay. All right, I think we have one more. The nurse should include which action in the plan of care for the client receiving enteral feedings? This is a select all that apply. Okay, so you have to know about the skill enteral feedings. If you haven't covered that, you may want to review that. Especially if you have that skill coming up in your skills lab class. This is going to be a very important thing to know for this skill. All right, your choices are, okay, select all that apply. So this could be one answer, 2, 3, 4, 5. All 5 could be correct. Okay, so that's why select all that apply are tricky. They, when you're answering select all that apply, go through each answer choice and treat it as a true or false. And just answer, is that one true or is that one false? And go through each one. Okay, so what action in the plan of care for the client receiving enteral feedings? Select all that apply. A, position the head of the bed in semi-fowlers during feeding. B, check placement of tube before initiating feeding. C, maintain the head of the bed elevated between 30 and 45 degrees at least 30 minutes after feeding. D, allow at least 90 minutes for each feeding. Or E, notify a primary care physician for gastric residuals of 100 to 200 cc's. All right, we'll give you a minute on this one. Okay, we're back. Let's look at these answer choices and which ones are correct. So the correct answers are B and C. B is check placement of tube before initiating feeding, and C is maintain the head of the bed elevated between 30 and 45 degrees at least 30 minutes after feeding. Okay, so minimize the risk of aspiration by checking proper tube placement before initiating feedings and at frequent intervals. And when you cover that skill in Skills Lab, your instructor will tell you what is the most evidence-based procedures for checking proper tube placement, and those have changed from the past. More current evidence has changed those a little bit, so make sure you know those. And the nurse can also minimize the risk of aspiration by keeping the client in Fowler position, the head of the bed elevated at least 30 to 45 degrees. At all times when feedings are infusing and for 30 minutes after completion of intermittent or continuous feeding. Okay, and letter E is not correct because that's a normal amount of gastric residual. Normal or safe gastric residual volume, or GRV, is generally less than 500 cc's or milliliters. Okay, so that's a normal range. Okay, so your answers are B and C on this one. Okay, and that's all we have for today. We'll see you on the next one. Have a great day.